All right. Well, good morning, everyone. Hope you all are doing well. I am very thankful that you are joining me today. This is going to be a very special webinar. I just started the chat box, so if you are able to open up the chat box, say hello where you are logging in from. I would absolutely love to get to know each and every one of you. And hello to my YouTube family as well. Excellent. We have Mohammed here, Ari Haran, Zainab, Yukta. Excellent. And if you are just logging in, feel free to just make sure you are opening up your chat box. I would also recommend you to take notes throughout this session. So I always have a little notepad next to me, and my hope is that you will be able to cut out distractions today and take some notes on these very effective learning strategies. Excellent. Well, as you can see, there are so many people here today. We have an international audience. Over 300 people have signed up for this webinar. And let's go ahead and get started with today's topic. So throughout this session, what I would encourage you to do is cut out distractions. Make sure that you silence all notifications, put your phone away, close those other browser tabs. Make sure you take out your notebook and also have your chat box open, because this is going to be a very interactive session. Today's topic and YouTube video is pretty unique in the sense that we are going to be going through a little bit of learning science. It's not going to be hardcore topics such as, for example, an organ system or a clerkship that I'm reviewing, but rather I'm going to be empowering you on how to effectively take notes from a very popular USMLE study resource, and that is going to be UWorld. This is going to be a very practical guide, and if you stay until the end of this video, I will be giving you my exclusive UWorld Notes template. This UWorld Notes template is going to be hosted on Notion. If you do not have a Notion account, Notion is a free account for students. If you go to notion.so, Notion.so, you can create your own account and you will be able to utilize this template for your learning. So I'm very excited that I can share this template with you. It will benefit you for step 1 shelf or step 2 CK preparation. By show of hands or in the chat, how many of you have joined one of my webinars before? How many of you all have joined one of my webinars before or seen one of my webinars? Okay, great. We have a good amount of people who have. And for those of you who have not, I want to extend a very warm welcome to you as well. My name is Rahul Damania. I am a practicing pediatric critical care physician. I also recently completed my master's in medical education, and I have an absolute passion about helping students just like you prepare for and excel on the USMLE Step 1, NBME, shelf, or even Step 2 CK exam. Feel free to connect with me. I have many courses that are rooted in active recall, and these courses have been an absolute game changer for students for both Step 1 comp and Step 2 CK, as they are focused on active recall and integration. Just a couple of days ago, it was Thanksgiving Day, and here in the States, Thanksgiving is a big deal. And I wanted to actually just spend a moment thanking you for joining me this morning, evening, night, wherever you are logging in from, or if you're seeing this at another time, I want to also thank you for spending the time to really learn this skill that I am very confident will help you for your future learning and USMLE exam. So I do want to go through a little bit about what makes HyGuru very unique. HyGuru is a very evidence-based, learning science-rooted approach to preparation. In particular, for USMLE preparation, I like to focus on vignette-focused learning and active recall. I like to make links amongst topics, and that is going to be creating links amongst organ systems. I also like to focus on test-taking strategies, having a systematic approach, STEM, paraphrase, predict, is the approach that I use when I am preparing students both in my courses and one-on-one. And finally, I want to make sure that I set you up for peak test-taking psychology so that you walk in to Prometric exam day with confidence. One of the other areas that I focus on is productivity. Dedicated study is such a grind. And my goal is to make sure that I equip you with the tools to effectively and efficiently study. It is not about the quantity of how many hours you study, it is the quality of the hours you are putting in. And my hope today is we concentrate on this bucket, the performance bucket, as we unpack a very important skill, and that is how do you review and take notes from UWorld effectively. Most importantly, and we have over 100 people joining us today, HyGuru is genuinely a family. It is a community of lifelong learners in medicine. My goal is to extend beyond the exam. My hope is that this methodology of preparation can help you as you become a resident, fellow, and beyond, because it is at the bedside where it matters. And studying for the USMLE provides us a foundational knowledge base so that then we can apply it to our patients. As you can see from this slide, I have been very humbled by the success students have had working with myself, as well as engaging, especially in my courses. This is a glimpse of some of my Step 2 CK students. I also have worked a lot with Step 1 students. And a population that I have loved to work with are students that are from international backgrounds, students who are from DO backgrounds. Also, I have been humbled to work with students who may not have passed the first time, either Step 1, Step 2, comp, or a shelf exam, and helping and guiding students through that process. So one of the things that I really want to focus on is the comp and CBSE. I want to emphasize that this webinar is going to be a prequel or a pump-up session for next weekend's two-day course. If you are studying for Step 1, NBME, the comp or CBSE exam, I would encourage you all to go to hyguru.com, and under webinars, I am going to be hosting a two-day class. This is a class that is going to be focused on high-yield NBME vignettes, test-taking strategy, even images. We're going to cover the top 100 concepts in a rapid review manner that are tested on every single USMLE exam. This is going to be also a very unique session because not only is it going to be a pump-up session for next week's two-day course, but it also is kind of an update video to a video that I recorded on my YouTube channel a few years ago, where I went through a systematic way on how I utilize Notion to review UWorld. My hope is that this updated video is going to help you for Step 1, Shelf, Step 2, CK. And so please make sure that you stick around through this session, take notes through this session, and I will be providing you at the end a Notion template that allows for you to review UWorld in the methodology that we will be covering. So what is UWorld? By show of hands or in the chat box, type in yes if you've utilized UWorld or have heard of UWorld. And if so, is it for Step 1, Step 2, Shelf? Excellent. We have many people who have raised their hand or put in the chat box, yes, I have been using UWorld. I think UWorld is great. I've been using UWorld for many, many years. I just want to give a background for those of you who may not know what UWorld is. UWorld is a question bank, and this question bank is one of the gold standard preparation resources for USMLE, NBME preparation, whether it's Step 1, Step 2 CK, or Step 3. It started in 2003, where Dr. Pemasani, who is the founder of UWorld, actually was a resident, and he wanted to create practice questions, and he was going to publish it as a book. But what he started doing was he put it in an online forum, and many people in the online forum back in those days, there were blogs and online discussion forums. they really resonated with it. And so he started UWorld, which has, again, been a gold standard question bank, has beautiful explanations. 95% of USMLE Step 1 takers, I think even more, use UWorld in some way, shape, or form for either Step 1, Step 2 CK, shelf preparation, and Step 3. It is a big company, and it also expands to COMLEX preparation as well as other exams like the MCAT, for example. I do want to share with you all that just a little over a year ago, I was very fortunate enough to meet the founder of UWorld and spend some time just talking to him. And for me, I was like nerding out because this is like meeting a celebrity as I'm in the medical education space as well in USMLE preparation space. So it has been wonderful to So this is a great time for me to pause. And what I want to do is I want to pause and put this question into the chat box. And that is, what makes reviewing UWorld challenging? Go ahead and switch your chat box function to everyone. And I'd love for you to weigh in on this. What makes reviewing UWorld challenging for you? If you change your chat box setting to everyone, that will be great, because then we will be able to see just people who may be sharing in a similar problem. Okay, it's very time consuming. Grasping and co-linking each of the parts, it takes way too long. Yes, absolutely. Excellent. Some people are talking a little bit about time management and how it's hard to retain information. There's a lot of information. And I want to just take one step back and let you know, when I was going through all of this, I had similar problems. I still remember it taking me 3 hours just to get through 20 questions. And that's why I hosted today's session, because I have been in your shoes for all of these USMLE exams. And my hope is that I make it just a little bit easier for you today. And what we're going to be doing is we're going to be coupling not only my experience, but some of the learning science behind how to review effectively. And we're going to come together, create a system together. And my hope is that this will leverage not only your or improve your time management, but also it will leverage a high fidelity learning approach so that then you can retain the information. So thank you for participating in this prompt. And let's go ahead and go through some of the responses that I saw in the actual chat box. So explanations are dense, reviewing blocks on the same day, time mode versus tutor mode. It takes a lot of time to review. What about other resources? What about other question banks? How do you take notes? These are all going to be things we are going to be covering over the next hour or so. So if you guys are ready to get started, go ahead and type in yes into the chat box. Everybody ready to get started for today's review? All right. Excellent. We have some familiar faces here, which is awesome. Excellent. A few disclaimers. This is intended to be a very focused session. I'd encourage you to just cut out any distractions. I'd also encourage you to take out a notepad and kind of create a UWorld learning protocol with me. This is going to be advice from an N of 1, but I have worked with many students, and my hope is that that experience can be transmitted to you. And remember that this is just one way of going about it. The best way to review something is creating your own system and being consistent with it. So my hope today is that I don't overly complicate things. I make it very simple. We're going to be zoning in on certain key elements for your learning. But I just wanted to create this disclaimer that this is just one person's viewpoint or opinion on how you can review UWorld effectively. All right, so let's go through a quick overview. What we're going to be doing first is we're going to be understanding differences between Step 1 versus Step 2. We're also going to be creating a learning philosophy surrounding UWorld. I think it's very important that when you're trying to change your behavior towards anything, you have to incorporate a value system. So we're going to create a value system, and there are going to be some key psychology shifts that I want to impart onto you. We're also going to be covering whether or not we should be doing tutor mode or time mode, and what are the benefits or pros and cons for each. I'm going to be introducing 2 strategies on how you can practically review UWorld leveraging Notion. The first one is going to be the Fab 5 technique. And then the second one is the open leaf mnemonic. Now, this is going to be a little bit of an involved mnemonic, but my hope is that you continue to write your notes down. And as you're reviewing UWorld, you have a piece of paper that has the open leaf mnemonic that we will be going through. What I want to start out with is a compare and contrast between step 1 and step 2 CK. This webinar is going to be very pertinent if you are studying for shelf, step 2, step 1, or even your comp or CBSE exam. Remember that step 1 focuses a lot on foundational sciences. What is the likely mechanism? Recognizing the diagnosis. What is the underlying etiology behind, for example, a pathophysiologic series of events? What is the underlying etiology, for example, for micro or basic immunology or biochemistry? So step 1 is all about foundational science, whereas step 2 CK, as many of you know, is all about clinical sciences, recognizing diagnoses. How do you interpret key labs, for example, management, whether it's diagnostic or therapeutic, or identifying a risk factor related to a certain disease? So my hope is that as we get started in this mindset building phase of this webinar, I want to take your current approach and I want to create a philosophy surrounding this approach so that then we can optimize our performance together. Here's going to be the first test taking psychology. Embrace getting questions wrong. I made a TikTok about this about a week ago, and I really believe in you looking at UWorld as more of a learning resource. Embrace getting questions wrong, because there hasn't been a study out there that correlates a % correct on UWorld related to a passing score or a very successful 3-digit score if you're talking about step 2 CK. Your goal is to be better than your prior block and set that intention and deliberate practice. Don't be afraid to be wrong, because you might as well be wrong now than on Prometric exam day. Many of us like to do UWorld and chase the dopamine of being correct. This is going to be in the midbrain. This is called the ventral tegmental area. And the ventral tegmental area secretes neurotransmitters like dopamine and is going to transmit that dopamine to the frontal lobe or to the limbic system. And all in all, this is going to provide the basis of an addiction. And what I mean by this is you don't want to keep chasing the dopamine hit of, oh, question, did I get it right? Did I get it right? Did I get it right? You want to chase the dopamine hit of, have I learned? Have I reflected on why I'm getting it wrong? Do I know how to think like the test maker, for example? These are much more important things to chase rather than just a % correct or getting the question right. Be okay with getting questions wrong is the first philosophy. Now, many of you have taken NBMEs, right? And when you're talking about UWorld, it's no different, right? You get a % correct or you get a 3-digit score. And sometimes people think success looks like this. Oh, yeah, from NBME 9, UWorld 1, NBME 12, it's going to be a linear trend. But guess what success actually looks like? It is an up and down, up and down, up and down, like the stock market. But the overall trajectory is that you're going to get better if you intentionally put your mind to improving. Similarly, how do you improve in UWorld blocks? You have to embrace the fact that your performance is going to go up and down, up and down. But if you can reflect on why those things are happening, if you can create a system, you will be able to have an upward trajectory, just like how the stock market over the last 100 years has had an upward trajectory in terms of rate of return. The other value system that I want to impart on you is think of your mind like a computer. If you are going to input your mind in a haphazard way, oh, I'm going to do Notion here, Word document here, Excel file here, unlock Anki cards here, you're going to get a very disorganized output on exam day. You won't be able to kind of capture where was this content that I was taking a note on, etc. What you want to do is think of your mind like a computer. If you feed it in a very organized way, you're going to get a much more optimal output. And that's why I like to say, keep your notes in one area. Keep your Notion notes in one specific area. If you don't want to use Notion, whatever you use, do it systematically, do it methodically. And that's going to be our goal today, is to create that system so we feed our mind in an organized way and we can have a organized output. Here's another key psychology point. The UWorld explanations, like many of you have mentioned, are wonderful, but they're very dense. How many of you agree with me on this? UWorld explanations can be very dense. Yes? People are raising their hands. Yep, I agree. Absolutely. And I know textbooks have kind of fallen out of favor because there's a lot of video resources for the USMLE. But what I do is I've shifted my mindset and I think of UWorld explanations like a textbook. So if you look at a UWorld explanation, here is a body of text, just like how textbooks have paragraphs, for example. UWorld is going to have a clinical case that introduced the textbook chapter. It's going to have like a summary page like a textbook. It's also going to have some bold headers like a textbook as well. So if you shift your mindset to say, oh, this is just a textbook chapter that I need to read after a clinical case, then you will kind of solidify the fact that this is a much more of a learning resource than it is an assessment resource for me. Another test-taking psychology: create a consistent system to refine your results. Remember that consistency and the discipline to do something over and over and over again with the intention of always improving, that deliberate practice, is very important. So when we're going to create our system, you might go back maybe a few days from now and be like, this is not working for my learning. Okay, now you have refined your system. So the more that you are going to be creating a notes system, for example, in this discussion, you want to reflect and you want to say, how can I make that better? How can I make it more tailored to my learning? Don't do a blanket approach. Do the approach that is going to work for you. So like I say to all my residents and fellows that I work with, whenever you see things commonly, you want to create a system, because systems lead to standardization, right? That's why the healthcare system has so many checklists, because we want to standardize things, protocols, care paths. But what we also want to do is we want to make sure that that standardization can lead to optimization. You want a standardized approach so that then you can optimize your results. And what is the gap here? The gap is you. The gap is making sure that you're reflecting on, why are you getting questions correct? Are you being efficient with your note-taking? The gap here is focusing on active learning elements. Are you making your vignette-based notes, or are these like random fill in the blank? And the gap here is making sure that you're not just showing up and going through the motions. I mean, come on. Doing questions is the easy part sometimes, but actually learning from them is important. I have seen a phenotype of students. Again, I've been working with students since my M3 year. So the past 8 years, I've seen a phenotype of students who are like, yeah, I've done all the UWorld, I've done all the NBMEs, but I still can't pass, or I still can't do well. And what I now recognize is that those are students who are just going through the motions. They're just doing the questions, but not necessarily spending the time to reflect and deliberately learn from those questions. And so this is a great study from simulation research, which many of you in medical school or even in residency will go to the simulation lab to practice your skills. And the goal here is to figure out, what is that micro skill you want to work on when you are going to be doing UWorld questions, when you're reviewing UWorld questions. Maybe the micro skill when you're reviewing UWorld questions is something like, oh, I just want to focus a little bit better. Maybe the micro skill when you are doing UWorld questions is, I want to make sure that I pause after every sentence, coming up with the likely concept or diagnosis they're testing me on. Set a micro skill before you go into a study session, because that is how you're going to improve. For example, I was on call yesterday, and what I wanted to do was I really wanted to make sure that I set a micro skill of just being a little bit more intentional about following up on labs. Yes, I follow up on labs all the time, but I wanted to make sure that I really focused in on interpreting labs, making sure that I communicate the labs effectively. We all need to set those micro skills for ourselves, stay accountable to ourselves, and have that lens of always improving. Embrace the difficulty, but make sure that you have a forward-thinking lens on how you can improve. All right. That is the mindset piece. Is everybody feeling pumped? I know I get kind of passionate about this. My wife tells me that all the time. Rahul, you're getting way too passionate about things. Excellent. Well, I appreciate you all really embracing this mindset with me. Excellent. So now what we're going to do is we're going to be transitioning into what a typical study session looks like. You may be following the same pattern. The first thing is we're going to be talking about how to do UWorld effectively. The second is concentrating on the process of reviewing UWorld. And the third, we're going to be talking about how do I retain material. Let's go ahead and first talk about doing UWorld. Now, there's tutor mode and timed mode. Tutor mode is where you're going to get immediate feedback. Time mode is where you're going to do a block of 20 or 40 questions, and you're going to see the answer explanations at the end. Now, with tutor mode, you get immediate feedback. You go through the question, you pick the answer, and you get immediate feedback. When you're reviewing explanations, right then and there, that might help you for future questions in that set, especially if you're doing, for example, a focused cardiology set. Going through 3 or 4 questions may help you for question number 15. It also is a reduced cognitive load when you're doing tutor mode. However, the contra or the cons of doing tutor mode is that you get limited test taking practice because your exam is not tutor mode. Your exam is time mode. So that's one of the limitations. The tutor mode also sometimes gives you over reliance on feedback. I still remember doing tutor mode, and like just because I wanted to get the question correct, I had like this weird psychology, and I was just like twitching to the right answer, and I would get it wrong, and then I would feel bad right in the moment because I got it wrong. You get that weird dopamine hit of wanting to be correct every single time, and that instant gratification is something that kind of psychs you out, but is something that you chase for. Now, with time mode, this simulates exam conditions. It encourages independent block strategy. You have to figure out a strategy on how to balance time. Do you mark questions? You have to figure out a strategy of timing, making sure that you get it done in a deliberate and within an hour, for example. It also allows for interleave learning. Many of you are doing time mode with all of the organ systems or all of the clerkships. So you're interleaving neurology, OB, you're interleaving biochemistry, immunology, etc. There is a higher cognitive load because there are many skills that you have to do when you're doing a time test mode block. And finally, there is less effective knowledge correction in the real time. So it is less effective for immediate knowledge correction in real time. And that was one of the advantages of tutor mode. So it is just a balance. For me to kind of recommend one blanket approach is not necessarily going to be as effective as you understanding the pros and cons of doing it in tutor mode versus time test mode. But I wanted to give you a little bit of guidance here. Now, with tutor mode, it's going to be helpful if you're, for example, just going through UWorld for the first pass. Let's say you are going to be doing a cardiology block as an M2, and you want to get through cardiology questions and concepts. This is the first time you're going through cardiology ever. If it's the first pass of your material, you can utilize tutor mode. I still remember utilizing tutor mode when I was doing my internal medicine shelf questions. For majority of them, as I was starting out, I did tutor mode for that clerkship. Tutor mode helps you build an initial schema towards a certain diagnosis or concept. Tutor mode also is very beneficial if you want to focus in on a clerkship or focus in on an organ system or a domain. Maybe you just want to get through all of the ethics questions and you'll do tutor mode as a result. Tutor mode is also effective when you're very distracted, right? You can't have like a solid study space for hours and hours. You're like, on the wards, or you're just trying to fit in some questions between patients if you're in your third year, or you only have 10 minutes before your next basic science class, that is going to be where tutor mode is going to be most effective. Time mode is going to provide you realistic pacing. It's going to really help you develop the skills that you need for Prometric exam day. It helps you with building stamina. Again, usually you're going to do time test mode for interleave practice, maybe one or two organ systems, or maybe all mixed organ systems or mixed clerkships. It is going to be especially important for you to do time test mode during dedicated study when you're about 6 to 10 weeks before your exam. You want to definitely leverage time test mode because it allows for you to have focused preparation of what you're going to need to do on exam day for 7 to 8 hours. Now what we're going to do is we're going to be transitioning and going through the process of reviewing UWorld. Before we go into this, how many of you are currently using UWorld? And if you're using UWorld, are you doing it in tutor mode or time mode? Yolanda put tutor mode calms my anxiety. Go ahead and type into the chat. What are you all doing UWorld in? Excellent. Well, what I would encourage you is that if it's the first pass of your material, then definitely do tutor mode. But if you're getting close to an exam like a comp or a CBSE, step 1 or step 2, or even a shelf exam, you do want to transition into time mode because time mode pushes you out of your comfort zone. It allows for you to have a ability to practice your knowledge and put all of the pieces of the puzzle together. Now, what we're going to be focusing on now is process of reviewing UWorld. One of the resonating themes that I like to put out there is you want to review your UWorld block the same day or as close to when you finished the UWorld block. This is extremely important. I'm going to be a little bit extreme here. It is very inefficient for you to review yesterday's blocks today. If you are waking up on a Tuesday and you are saying, I need to review the weekend's blocks, in my opinion, that is the height of inefficiency. So what you want to do is you want to review your blocks and the explanations the same day that you have done UWorld. Why is that? Well, think about the concept of neuronal plasticity. When you're thinking about neuronal plasticity, you just did a UWorld block. And now you have some questions that you got right, some questions that you got wrong. If you think about neurons, they're trying to find a home now. When you're reviewing, they're trying to figure out, ooh, is this incorrect thought process? Can I turn it after he reviews to a correct one? Or here's a correct thought process. The neuron wants to solidify that because you got it correct. So you want to review your explanations closest to when you created the emotional response. And guess when you created the emotional response? When you did the question. Because when you're doing questions, you're creating emotional responses. Maybe some emotional responses are like, oh shit, I actually don't know anything about this. Whereas other emotional responses are like, yes, I did video on this yesterday and I got this question. Yes. You're creating emotional responses. So your goal is to solidify the content knowledge with the emotional response in a very close proximity. The other thing that is going to be important here is when you review your block the same day, you already have momentum. It actually is much quicker because why? You are not rereading over and over and over again. If you are going to be doing the weekend's review on, let's say, Tuesday, you have to reread everything. You have to figure out what was Rahul thinking at that time, etc. So make sure that you are going to review your block the same day. All right, here is another test-taking psychology. Not all incorrects are created the same. Too often do I see students at times go 1 through 40 and they just go in a linear fashion. Oh, I'll start with question 1 and I'll go forward. Remember, that there are some incorrects which you got maybe due to silly mistakes, maybe due to a changing your answer. You want to be strategic on which incorrects you are going to be reviewing first. Avoid the 1 through 40. Be strategic, utilizing learning analytics. And that is where I'm going to be talking about the Fab Five. So what do you want to do? You want to combat the natural tendency of starting with question 1 and moving down. That's not what you want to do. You want to use the UWorld Learning Analytics dashboard, which I will show you. And that will help you figure out which are the ones you need to clue in first when your focus is going to be very high. So the objective criteria that I use, these are the first 5 incorrects that I am going to review. And I called this the Fab Five. These are going to be the 5 most important incorrects that you need to start your study session with. So what is the Fab Five? It is a strategic approach on reviewing your incorrect questions when you get them wrong in UWorld. It uses learning analytics and data to drive your decision-making. And it serves to be a launching pad, because when you're reviewing UWorld, you don't want to go 1 through 40. You want to review UWorld by first starting with your incorrects, then starting with your marked questions, and then going to your correct. Maybe the marked questions are the ones that were very challenging, that you also were down between 2 answer choices. Those are the ones you want to mark as you're doing the questions, and you want to review those marked questions in the second layer. But what we're going to focus on is what are your most important 5 incorrects that you want to hone in on. So here is a test-taking psychology. Be strategic. A lot of students really want to create notes on things that they already know. Don't focus on things that you already know. Learning is about being outside of your comfort zone and filling in the gap. I am here on this topic. I got a question wrong. I need to go here on this topic. Don't just keep annotating and reviewing things that are in your comfort zone that you already know. If you know that the heart has 4 chambers, you don't need to focus on those questions. You need to focus on the more challenging questions for you. All right. So you just submitted a mixed timed test mode block. Are you guys following me so far? Is everybody doing okay? Yes? All right. Very good. I encourage you to continue to pay attention, as now we're going to be going into some more detailed approaches here. So you just submitted a mixed time test mode block. As you can see, the score was 75%. It was a 40-question block. The first thing that I would encourage you to do, you just submitted it and you got your feedback, is I called this the rapid overview. That's what you want to put in your notes. Now, what is the rapid overview? This is honestly within 3 minutes, clicking through 1, 2, 3, just going boom, 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 boom. And what this does is this gives you a quick little flashback of what you just did over that last hour. So 1 through 40, quick rapid review within 3 minutes. You're like, oh, that was a silly mistake. I knew I messed that one up. Okay, this one, oh, good, I got it right. You're basically isolating the emotions that you had with each question as you do a quick rapid review. And then you are also capitalizing on which questions were just silly mistakes. And that's important for you to do. Make sure that you are going to do this quick rapid review. Again, it's only less than 3 minutes. You just submitted the block and you're going through the rapid review. Now, this is the next thing. After you have submitted the block and you did your 3-minute rapid review overview of 1 through 40, you're going to go for a walk. You're going to be going for a walk. Set a timer. I have a timer right here somewhere. And what you want to do is you want to set that timer and make sure that you go outside or go in your home for a walk or around the library. And why is that? Well, let's go through some of the key strategies here as why I think that this is going to be very important. So first off, when you're going for a walk, and let's see if this slide is going to transition. No problem if not. When you are going to be going for a walk, it is going to improve your cognitive function. It is also going to help you reduce stress. It allows for you to recharge, restore your attention because you're now going to come back wanting to review the block. And it enhances the reflection. Why did you get these questions right or wrong? Were there certain things that you were doing in this past block that gave you that really high 75%, or maybe that gave you a lower score? What were those habits? So you want to reflect on your performance on that 10-minute walk. So now what I'm going to be doing is I'm going to make an important point. And here's the important point. Make sure that you're going for the walk without your TikTok and without Instagram. It's hard. It's hard for me. I've even changed my phone to a black and white phone because we're in the age of distraction. And the currency now is not necessarily financial. The currency is actually going to be who can focus the most. You want to go for that walk without any distractions. All right, you're back to your study space. Go ahead first off. Do you guys like studying at home, the school, library? What's your favorite study space? Coffee shop? Okay, some people like library. I was a big library study. Okay, Daniela likes the cafe. Excellent. Yeah, and one of the things that I will say is that don't be afraid to rotate around different areas because novelty is actually a really important way for you to be productive. So sometimes I went from cafe to library, library back home, etc. So I think alternating is going to be a very effective tool. So now you're back, and what you're going to click now is you're going to be clicking the test results or analysis view, okay? Now, the analysis view is then going to give you this. And what you want to do is you want to filter for incorrects. And give me 1 second. I think that there is a lag between my computer and that. But what you want to really be doing is you want to be filtering all of your incorrects first, because you're going to start with your incorrects. Then you're going to be going to the marked questions. And then you are going to be going through a rapid review of your correct. So when you are in this analysis view, this is going to be where you're just going to filter incorrects. And now what we're going to do is we're going to go through what is the Fab Five. Now, this is for step 1 and step 2. All right. The Fab Five are the set of criteria that I use in order for me to review UWorld the most effectively. What I will do is in this view, I will choose the Fab Five topics. As you can see, this is the topics area. I'm going to choose my Fab Five topics based on, first off, which question was I most uncomfortable with? Then the next one, which are the 1 or 2 questions that I was down to 2? Remember, those should be the ones that you've marked. Number 3, which are the questions that I spent the most amount of time on? And finally, number 4, what are the questions that many people got right, but I did not? Many people getting right, maybe greater than 65% of people got this one right, but you did not. Those are the questions you need to focus on. Incorrects where percent correct others is high. And just as an overview, your goal is to understand what is the focal point of assessment for each of these questions. How do I recognize the illness script? Why did you get this question wrong? Where are connections I can make? This is based on schema theory. You want to create a connection between your old self on the concept and what you are learning now. Think about it as, I know something about this, but what I didn't know, I got wrong, or maybe it was a silly mistake, but then I need to encompass that back to my prior schema. So asking these questions as you're going through each of these topics and reviews is going to be key. The goal here is you want to actually link the vignette and your thought process to the explanation. And that is a paradigm that I want to emphasize. A lot of students, what they do is they just focus on the explanation, but your goal is to link the explanation to the vignette. And I can't stress that enough. So let's go ahead and go through this. What topic should I choose? Those that I was uncomfortable with, the down to 2 questions, spent the most amount of time, and comparison data based on percent correct others. So your goal here is to pick 5 to 7 of these. Start with 5 and then move forward. So let's do a quick example here. Here's the block that I submitted. This was a topic that I was going to be uncomfortable with. Here was a question that I was down to 2. Here was a question that I spent a lot of time on. And here was also a question where a lot of people got it right and I did not. So as you can see here, there might be some overlap, but your goal now is to be strategic. What are the questions that you want to lean into first when you are going to have the highest amount of focus? Let's do this again for step 2 questions, for example. Here is something that I was uncomfortable with, shoulder dislocation. Not too good with anatomy, so I'm going to review that first. I was down to 2 on androgenic steroids and preterm labor. As you can see, I marked those questions. I spent the most amount of time on question number 8, multiple myeloma. And finally, I see here that many students got this question right and I got it wrong. And also, here's the contra. Not many students got this question right, and I didn't either. So this might be a hard question. The point is utilizing comparison data will help you. All right. So let's move forward here. These are going to be what I call now your Fab 5 questions, okay? Now, what do we do with these topics? These are the topics that we are going to review, and these are the questions that we are going to review first. And so what I like to do is I like to set a timer, and I like to say Fab 5 in 45, Fab 5 in 45 minutes. So in Notion, and again, if you stick around till the end of this session, I will be giving you the Notion template. But what I do is I just list them out here. Rheumatoid arthritis, multiple myeloma, steroids, preterm labor, etc. I just list these are the topics that I'm going to review. And then what I do is I tag the topics, okay? For step 1, step 2, the tagging might be different. Maybe for step 1, you'll do organ system, and then the domain being anatomy, embryology, physiology, pathology, etc. For step 2, you might do it based on organ system and clerkship, for example. So multiple myeloma is hematology, internal medicine. Preterm labor is reproductive and OBGYN. You get the gist. You want to start tagging these Fab 5 topics. And now we come to the long explanation. How many of you all are following me so far? Type in yes into the chat box. All right. What we are doing now is we have done the block. We did a quick rapid review 1 through 40. We went for a walk. We're now coming back. We are isolating our Fab 5 topics. And now we are going to go through how to review the whole explanation. The number one thing that I want you to think about here is you want to reduce cognitive load. Cognitive load is going to be something like this diagram. There's so much going on. Oh my gosh, oh my gosh. What you want to do is you want to give yourself this mindset. From the UWorld question, I can at most grasp 3 things, 3 different things from that one UWorld question. From that one UWorld question, you want to have 1 to 3 key takeaways. Don't try to go through everything. Focus on one specific aspect. For example, in the explanation, if they give you, for example, in step 2, they give you an algorithm, right? And the algorithm has so many different branches, etc. You want to focus on the branch that the question was testing you on, because you'll get other questions surrounding this side of the area. So don't try to master everything. Just focus on one aspect of the table or one aspect of the algorithm. So that's why I like to say, what is the gap? This was my confidence before going into the question. This is what I need to learn. Identify the gap for yourself. And so now what we're going to be doing is we're going to be going through the open leaf approach. That is just a mnemonic that I made with ChatGPT's help. And these are the steps that I use to review an explanation. Now, I'm not trying to make this overly complicated. What I am trying to do, though, is slow it down for you so you have a protocol to follow. The first thing that I want to mention before we go into the open leaf mnemonic is you want to avoid the Anki twitch. And what is the Anki twitch? I think Anki is great. If it works for you, awesome. But I would say, and I would argue, that vignette-based notes, capturing the vignette and putting it more in an illness script is much more superior than unlocking random Anki cards or Anking cards. My approach is for you to leverage the constructivist learning theory, which is where you are going to be taking different parts of the vignette, different parts of the explanation, and putting it into your own worldview. Because then when you review that, you have created that, you have constructed that. So your retention is going to be much better because that was your worldview of how you conceptualize things rather than Anking's worldview. Open leaf approach. O is going to stand for orient. P is going to stand for pinpoint. E is going to be emphasize. N is going to be navigate. L is going to be locate. E is going to be engage. A is going to be adjust. And F is going to be finalize. This is going to be the strategy that I use for every single Fab 5 or every single UWorld question. My hope is that you go through this stepwise approach with me now, okay? So please write this down because this is going to be one of the most important slides of this session, okay? All right, let me go ahead and actually delete this and go back to from current so we have this. All right, first thing that you want to do is you want to orient yourself to the topic. The topic is usually at the bottom of your screen when you get to a question explanation. This helps you build context. Oh, this was a question from my OBGYN clerkship. Oh, this is a question related to pathology, for example. P, you want to pinpoint the educational objective. Focus on the big picture. The educational objective, when I write test questions, I start with an educational objective. I want to assess you on this specific aspect. E, emphasize. Emphasize the bold words. It acts as a primer. When you are going to be reading a textbook, what are you going to start with? The headings of the textbook, right? You're not going to just start with, okay, page 1. You should first look, okay, these are the bold words that they want me to know. Emphasize the bold words because they act as a primer. This is one of the most important steps. I'm going to put a star right here, focusing on those bold words. Then what you want to do is you want to navigate the vignette. You want to create, very importantly, you want to create a link between the bold words and the way the vignette was written. Let me repeat. You want to navigate the vignette by linking the bold words to how the vignette was written. If the bold word was thrombocytopenia, you should look up in the vignette and you're like, my mind needs to say thrombocytopenia when I see a number that shows a low platelet. That is thrombocytopenia. You want to align the bold words with the thought process that you were having during the actual doing of the question. L, you want to locate the focal point of assessment. You want to look at the vignette stem, which is the lead-in. What is being tested? They want me to know the likely mechanism behind this medication. What is the likely diagnosis? They want to have me recognize a diagnosis. So focus in then with the L in the lead-in, L for lead-in. E, you want to then, after you've done that priming, bold word to the vignette, figure out what they actually wanted you to know from that question. Then I take my hands, I sit on my chair, and I make no notes. I just read the paragraphs, trying to make connections. I engage actively without taking notes. And I want to internally link, did I know that? Did I not? When I'm reading the paragraph, I'm also thinking about it from a process standpoint. Okay, this sentence leads to this sentence, leads to this sentence, leads to this sentence. Ooh, this is different than what I knew. This is the same thing that I knew. This is how this question was written, etc. That is how you're going to improve and do it in a time-based way, is you look at the bold words related to the vignette and then you engage actively in the paragraphs without taking notes right away. Then you want to only look at D is wrong because. So wherever you got it wrong, that's the only place, in my opinion, that I look, unless I was down to like 3 or 4. But usually you can eliminate some of them and you are usually down to 2 or 3 and you may have picked the wrong one. You want to adjust by flipping the script. And we'll elaborate on this, but that is the only area after the paragraph that I focus on is my incorrect answer. D is wrong because, for example. And then F is going to be, what is that 1 or 2 things that you want to finalize? Finalize with identifying the gap. 1 or 2 things that you want to take away. Keep the cognitive load low. Open leaf, orient, pinpoint, emphasize, navigate, locate, engage, adjust, and finalize. Let's go through this in a little bit more depth. Orient, as you can see from step 1 bank, this is testing me on anatomy. This is from female repro. The topic is amenorrhea. This is from shelf review, OBGYN, female, imperforate hymen, for example. Okay, so that's orient. Then what are you going to do? You're going to pinpoint the educational objective. The educational objective is right here. Adolescent girls, primary amenorrhea, has normal secondary sex characteristics, vaginal bulge, and mass at the anterior to the rectum. That is going to be related to the concept of imperforate hymen. So you'll read the educational objective. Then you will emphasize the bold words. The bold words here: primary amenorrhea, normal secondary sex characteristics, cyclical abdominal pelvic pain, outflow obstruction, imperforate hymen, hematocolpos, palpable mass anterior to the rectum. So these are all going to be what? These are all going to be the bold words that you're going to emphasize. Then what you're going to do, and watch this, you are then going to navigate. So look at this bold word right here. Primary amenorrhea is the bold word. What did they put? She has never had a menstrual period. Second, normal secondary sex characteristics. Look in the vignette. What do they put? Cancer stage 5. Outflow obstruction. That is going to be this palpable mass anterior to the rectum. Hematocolpos, same thing. So this is an emphasizing topic. Palpable mass, same thing right here. And what was the focal point of assessment? That is imperforate hymen. So let's understand the next part. So we've went through open. Now L, locate, the lead in. The focal point of this question, what is the likely diagnosis? So they wrote this question so that you can really recognize the diagnosis of imperforate hymen. That's the locate part. Locate is the lead in. That's the focal point of assessment. And then now you will engage. Because you've done bold word to the vignette wording, you will now sit on your hands and you will just read the paragraph line by line, line by line, line by line, trying to make connections. No notes, just connections. You will then look at wherever you had the wrong answer. Maybe I put C is wrong because, and I put C, the correct answer was going to be D, and I put C. I only will read that part right here because that was the one that I got wrong. And what I want to do is I want to adjust. And what that means is that I want to look back at the vignette and say, what should I have paid attention to that should have completely altered my thought process from endometriosis to imperforate hymen? And look at this. Endometriosis is not associated with amenorrhea. So as soon as they said no, I should have said, that's not endometriosis then. So identifying what was the pertinent negative in the vignette that should have led you more towards the correct answer and away from the incorrect answer. So I like to say, if this is a ship and you're going from point A to point B being the correct answer, you went from point A to the incorrect answer. And you want to understand where in the vignette did you go wrong that can then lead you back to the right answer. So there was a data point that may have confused you that made you go to another direction and you want to change the vignette, what I call flip the script. If you put, for example, she did have periods and she had cyclical abdominal pain, maybe endometriosis would have been more correct if you flip the vignette like that. Okay? And then lastly, it's finalize. What is one or two things? Oh man, I didn't realize that secondary sex characteristics are going to be seen in imperforate hymen. Perfect. I have now identified the gap, the one or two takeaways, so that I keep the cognitive load low and I trust the process that I'll get another imperforate hymen question, for example, if that topic is very highly stressed and important. All right. Now we are going to be focusing on creating a vignette-based note. So far, are you all understanding, recognizing where I'm coming from here? Is everybody enjoying this thus far? This is what I call a metacognitive type of webinar where you're learning how to learn, okay? All right. So now what we're going to be doing is we're going to be focusing on creating a vignette-based note. So like I said in the focal point of assessment, I want to tell you what is the stem. The stem is right here. This is called the lead-in. Which of the following is the most likely diagnosis? And that is the focal point of assessment. And what that means here is essentially what they want you to do is they want you to be assessed amongst these different diagnoses. They want you to recognize these diagnoses and essentially a factoid. So the way I remember this is I say, all right, the vignette gives me pertinent positives and negatives. And what they want me to do is they want to activate an illness script. You have to say, oh, this sounds like blank. This sounds like imperforate hymen. This sounds like transformation from genetics. And then they want you to know a two-step thinking. What was the factoid that they love for you to know within imperforate hymen? The point here, and this is how I've made my courses, is it's all about going from a lot of data, localizing what content knowledge in your mind does that relate to, and then there's a specific fact that they want you to know from that concept. That's exactly how I've made my step 1 and step 2 courses. What I've also done is I've mined the 85-page question writing guide. And that 85-page question writing guide gives us an insight of how questions are written. Let's go through this. Here is an anatomy of a USMLE question. We talked about the stem or the lead-in. And what it does is it starts with the broad chief complaint, gives you some history about the patient, and then goes into more objective physical exam, and then finally labs or imaging. And this is going to be the cadence of how we see patients and how many USMLE questions are written. Start with the chief complaint, elaborate with the HPI, give more history, then switch to the objective, which is vital signs, physical exam, labs, and imaging. So let's go through this. Here's a practice. What's the stem? Which of the following is the most likely cause of the patient's syncope? What building block is this? A 72-year-old man comes to the emergency department after a syncopal episode. What is that building block? Can you type into the chat box that first sentence? What is it called? The first sentence. That first sentence is going to be known as the chief complaint. You got it. Very good. All right, let's keep moving on. The patient briefly lost consciousness an hour ago while getting dressed. So that's the history of present illness. He remembers putting on a shirt and tie, and the next thing he remembers is finding himself on the floor with his wife at the side. So that is going to be the HPI. His wife reports that he had no abnormal extremity movements or involuntary micturition during the event. That is the HPI. The patient has had several episodes of recent lightheadedness, especially in the morning while shaving, but has never lost consciousness or fallen. These are recent events building his past medical history. He has a history of poorly controlled hypertension and a recent change in his medications. That is going to be his past medical history. Other medical problems include diabetes and hyperlipidemia. That is the past medical history. And then suddenly we shift into what I call the doctor's perspective. And the doctor's perspective here starts with the vital signs. Now we're going into objective. Blood pressure is hypertensive. Physical exam shows no carotid bruit and normal JVP. That's the physical exam. They're describing a murmur. That's physical exam. They give the neurological exam. That's physical exam. And the final part here is EKG shows normal sinus rhythm. That is going to be more of the diagnostics, labs, and imaging. So as you can see, every single question has this cadence, and this is called the building blocks of a USMLE question. And you want to identify these building blocks cold. All right, let's go through this. So what I want us to focus on is that the chief complaint has this organization. The chief complaint is going to have the tempo of the disease. If something is less than 2 weeks, it's known as acute. If it is 2 to 4 weeks, it is known as subacute. And if it is going to be greater than 4 weeks, that's going to be known as chronic. Then the chief complaint, you want to put into more medical terms. If I said my tummy hurt, you would say abdominal pain. Patients say, oh, this isn't feeling well. You will say generalized fatigue or something. You want to create more medical terms surrounding patient's chief complaint. And then from that first sentence, you want to understand the demographics of the patient as well. Are they young? Are they old? Are they a teenager? So let's go through this and I'll color code it effectively. Tempo here, 4 days. So what's the tempo? Go ahead and type it into the chat. What is the tempo? Good. If you're saying that the tempo is acute, you're absolutely correct. All right. What is going to be the chief complaint here? Go ahead and type that into the chat. Chief complaint is going to be, yes, lower abdominal pain. And how would you categorize the demographics? This is going to be a teenager. So the chief complaint you can turn into, they are trying to test me on acute lower abdominal pain in a teenager. Acute lower abdominal pain in a teenager. This is going to be important because where we're going to is creating vignette-based notes. We talked about the demographics, and what I want you to recognize is that the demographics in a vignette is basically defining the patient's narrative. It is defining, this is the patient themselves, and these are the past medical histories that they have, dyslipidemia, diabetes, right? Maybe they put, for example, recent syncope. I like to think of the demographics as being very closely related to the past medical history or recent events. Think of it as ornaments on a Christmas tree. If, for example, I put COPD as one of the demographic qualifiers or the relevant past medical history, and the person presents with shortness of breath, well, the patient has already now leaned into a COPD exacerbation because they are more predisposed with the ornament that they have on them of past medical history of COPD. So demographics, you always want to incorporate the past medical history or recent events. So this is the other important slide that I'm going to highlight. You will start with tempo when you're creating a vignette-based note. Then you will put the chief complaint and HPI. You'll try to summarize them together. Then what you will do is you will put the demographics, but incorporate the patient's past medical history and recent events. For example, a middle-aged male with history of diabetes and hypertension. You see how I put that here? With history of diabetes, hypertension, and recurrent bouts of passing out, recent events. Then you need to still capture the objective. So you'll say, who now presents with, similar to what you would do in a clinical rotation for your assessment, who now presents with, and then categorize the actual objective signs, vitals, physical exam, labs, and imaging. So you'll say, who now presents with hypertension, physical exam noting aortic stenosis, and a normal EKG, for example. So that's how you package all of those concepts together, okay? We're going to practice this, but please note that the linker word, I want to emphasize this, linker word, who now presents, helps you go from the patient perspective to the doctor perspective, okay? The linker word right here is who now presents with. All right. Is everybody excited now to have a live Notion demo? We have about 10 to 12 minutes left. And in this next part, I am going to be showing you this Notion template that I made for you all. And I hope that it's going to help you. I elaborate on a lot of these concepts and test taking strategies in my test taking course, in my step 1 and step 2 course as well. But I do want to emphasize and show you this Notion template. Do you guys see this template? Yes? All right. People do see my screen share. So what I'm going to do is I'm actually going to give you a example of this template. Just to orient you, this is on Notion. You will get the link to this. You will, in the top right, you can put it into your own Notion database so that then you can make this template your own. I have put like the open leaf approach, a tutorial video, everything here, Fab 5. And as you can see here, this is a table. You have QBank, whether it's going to be UWorld, RX, Amboss, the question number, what concept or topic. Again, you're going to put your Fab 5s here. Organ system, the domain or rotation. So if it's step 2, you're going to focus on rotation. If it's going to be your basic sciences and comp CBSE step 1, you're going to do the domain. This is just when I created it. This is when I last edited it. I put this here because sometimes I want to interlink notes as I build this database. And then this is a review status, and we'll get to this later on. But then you can tag something as reviewed, or I need to focus on this more, or I haven't started the review on this as you're building your own spaced repetition. So what I would recommend is that you either have UWorld on one side and then this notes template, or you have 2 separate monitors as you set this up. Pretend as if we had a UWorld question in front of us. Let's just read through this. Which of the following is the most likely diagnosis? 13-year-old girl is brought to the office due to lower abdominal pain for the past 4 days. The patient has rectal pain with bowel movements, but no melena or frank blood. What's the medical term here? In the HPI, this is dyschezia. She has had this pain several times over the past year, but it usually resolves after 2 or 3 days. So I always tell my students, several times a year, that is going to be recurrent pain. She has no fever, chills, nausea, vomiting, loss of appetite, etc. And the patient has no chronic medical condition. So her demographics is, you can put previously healthy 13-year-old girl. She has not reached menarche and has never been sexually active. So a 13-year-old girl without menarche, you're thinking of primary amenorrhea. Now you have the objective here. Here are the vital signs. Here's the physical exam. Here is going to be the further physical exam. There is lower abdominal tenderness to deep palpation. The external genitalia are Tanner stage 3. On pelvic exam, there's a smooth, firm mass protruding between the labia majora. Which of the following is the likely diagnosis? This is going to be the lead-in or the stem, okay? So what I first will do in this template is I would capture the educational objective. After you orient, you want to capture what is going to be the educational objective. Then what you want to do is you want to start relating the bold words to the vignette wording, as well as the building block of where you found it in. For example, the bold word of primary amenorrhea in the explanation, they put in the vignette, has not reached menarche. So that should relate to primary amenorrhea. And where did you see that in terms of building block? That was in her past medical history. Now, this column is extremely important, especially if you're studying for step 2. When I have worked with students who have scored high in step 2, they have this uncanny ability to understand why the patient's symptoms in the vignette are occurring. For example, cyclical lower abdominal pain, they know, oh, that's because of hormonal stimulation of the menstrual cycle causing the tissue to expand and then come down, expand and then come down. So this is the why, and that's important for us to note. So this table relates the bold word, vignette wording, what building block is it in, bulging vaginal mass is in the physical exam, and then why is this occurring? Then what you'll do is you'll create an organized illness script. Remember, start with the tempo. Then you go with the chief complaint and HPI, lower abdominal pain and primary amenorrhea. Then you will put the demographics incorporating the past medical history and recent events in a teenager with secondary sex characteristics and history of cyclical abdominal pain. This is all going to be the demographics, and I've put in the past medical history and recent events. Then the linker word to get us into the objective, who now presents with a labial protrusion. And I put that right here. Then I click the button, what is the focal point of assessment? And I just copy paste the stem. I copy paste the lead in and I copy paste the answer. So which of the following is the most likely diagnosis? That is what I copy paste right here when I click focal point of assessment. And then you'll go into the incorrect answer. Think of how to separate two answer choices, incorrect versus correct. Where did your thought process go wrong? And adjust the vignette to make your answer correct. So, endometriosis is not associated with amenorrhea. So the area that I should have focused on to get me away from endometriosis is when they said that she has not had her periods. And then I've created an error analysis table where you can actually rate your confidence. You can rate what kind of question type this is. And then finally, why did you miss it? Kind of like a journal prompt. So how do you use this template? Well, for every single question, you can hit new page. You can fill out the givens. And then what you can do is if you hit open right here, you can then activate a template within a template. And so then this will guide you through every single Fab 5 incorrect. This is going to be the cornerstone to your preparation. And for all of you, you all have stuck around until the end of this webinar. Here is going to be the link in the chat box right here. So feel free to take some time to open that up. Again, if you don't have a Notion account, go to notion.so, create an account. But here is the template. If you haven't seen it in the everyone chat box, here it is for you. And this is, again, made with intense love and respect to each of you, because I want to see you guys succeed. I don't want to make this complicated for no reason. I want to make sure that you are deliberately learning. That's the number one thing, guys, okay? All right, lovely. Let me go ahead and go into the remaining part of this. And this is just wrapping up some of the key concepts, okay? If you are still struggling a little bit with why, remember in that table, I had the bold word, then I had the vignette wording, the building block, and then the why. I have teamed up with med school bro, Jake Portnoff. He's a talented medical student. And him and I have created a series of ChatGPT prompts that can break down the pathophys. Hey, here's the mechanism behind why it's occurring. So that can help you if you are still struggling with linking the symptom to the pathophys. It's at chatgptusmle.com. Again, another free resource made for your learning. Whenever you're getting to that area of analyzing D is wrong because your incorrect question, you want to think of it as, oh, there is some 50 shades of gray. I am putting together endometriosis and imperforate hymen together. I need to separate them. So you need to kind of create that Venn diagram in your mind. How do you separate concept A from concept B? That's extremely important. Like I said before, your goal when you're reviewing a UWorld question, 1 to 2 or maximum 3 takeaways. Identify the gap. What was your prior schema? And link a new learning point to that prior schema. Think of it as leaves to a trunk of a tree. The leaves are the new details. You already had a core trunk of knowledge on this concept. All right. Frequently asked questions. I made a Notion template. Now, when do I review it? Okay. What I like to do is I call this the day prior approach. The day prior approach is if today is Tuesday, I am reviewing all the notes that I took on the prior day. I don't get cute. I just do the prior day, the prior day, the prior day. And that's why I put created time, because then you can just review the 5 to 15 or 20 questions, however many you put the prior day. You can start your next day when you're drinking a cup of coffee in the morning. You can start your day with the prior day's incorrects and Notion template review. I also like to use the status bar. The status bar being, have I not reviewed it? Have I reviewed it? Do I need to put the focus area? That's all in that Notion template. And then it comes down to, how do I utilize other question banks or video resources? For example, my resource, HyGuru, RX, Amboss, whether you're studying for step 1, step 2, whatever the case may be. What you want to do is you want to say in the evening, after you have reviewed your UWorld questions, I like to go into, for example, my course and watch the videos related to the Fab Fives that I missed. So for example, I would go to my video on imperforate hymen, or I would go to the Amboss article on imperforate hymen and do those questions on imperforate hymen. I go into RX and do those questions, do those flashcards. You want to use your Fab Five as opportunities for you to do tutor mode questions or video review in other resources. Now, what about the rest of my incorrects? A lot of students talk a little bit about this. What about the rest of my incorrects? You just told me the Fab 5, Fab 7. Well, first off, you want to review the rest of your incorrects the same day, like we've talked about. Then I utilize this metric. For the rest of the incorrects, I can go a little bit quicker. 8 to 10 questions for 45 minutes to hour and 15 minutes. That's the timer that I will set. And I will do maybe just a illness script note, and I won't do the whole table and everything like that. I'm just going to be packaging the illness script, maybe doing this mentally, or I have gotten very efficient such that I can expand my Fab 5 to like Fab 10 now. Your goal is to also focus on the analysis view, where many students got it right, greater than 65% in your UWorld Analytics view, but you did not. Focus on those questions next. Those are high yield questions. You're missing them. Rest of America is getting them right. So here are some concluding test-taking psychologies. Writing a note does not always equate to long-term retention. Do not make a note if you are not going to review that note. If you are going to be taking notes, you should spend the time to review notes. When you make a note, it doesn't mean you know it. So you want to be strategic and intentional. What notes are you going to be taking? The last point that I will make is you want to make sure that you avoid context switching. This is so important. A lot of students, what they do is they go into an explanation and then they'll get out of UWorld and start watching an Osmosis or RX or Boards and Beyond or Bootcamp video. You're not going to finish the whole block review because you're context switching. Master the content that's already in the UWorld explanation. Stop context switching. And back in the day, there was a big focus on annotating things into first aid. I would say don't annotate, correlate. So if you're going to context switch, let's say you have first aid open, just correlate. Do not write everything down. Just figure out, oh, this is where it was, but then focus on the UWorld explanation. That is so important rather than leaving the UWorld explanation during your review. I hope that this webinar really pushed you. Remember that success happens outside of your comfort zone. Learning is supposed to be challenging. Your goal is to start becoming more comfortable with being uncomfortable. I like this book on learning science. Learning is deeper and more durable when it's effortful. Learning that's easy, going through the motions, is like writing in the sand, here today and gone tomorrow. My hope is that you balance this approach with your personal wellness, because that is so important, balancing studying with your wellness, taking those walks. And I want to leave you with this. Just trust the process. This was one viewpoint, but my hope is that you can modify this to fit your worldview and to fit your study strategy. If you're still sticking around for this webinar or you're watching it at another time, I'm going to encourage you, please go ahead and open up this link, be featured as one of the star students with HyGuru. I like to make sure I spread this message one student at a time. So if you have the opportunity, it only takes a couple minutes to just write a review of what you thought about today. You can tag me on Instagram. I'm on YouTube. You can email me, post on Reddit if you're using my resources. And please note that next weekend, I will be hosting that comp review. So if you have not signed up, please go ahead and do so. The comp review is going to be at hyguru.com under webinars. I'm just going to go ahead and put that comp CBSE review in the chat box right here. And if you are interested in signing up for any of my courses, feel free to visit this website if you're studying for step 1. If you're studying for step 2, here is going to be the link. If you would like a more insight on test taking strategies, this is going to be my test taking strategies course. This test taking strategies course will help you effectively increase your performance on NBMEs and UWorld. So with that, I'm going to end today's session. Thank you guys again for joining. Before you leave, type in one thing that you learned, and feel free to go ahead and put any questions that you have in the chat box or also in my inbox. All right? Thank you so much. All right. For those of you who are sticking around, open leaf, that's a good one. Rapid review is important. Focusing on the Fab Five. Excellent. Wonderful. I'm going to go ahead and stick around for any questions. If you all are going to be utilizing the Notion template, here is going to be the link. Open leaf, I like that. Thank you so much. Excited to start reviewing my last UWorld block. Wonderful, wonderful. Excellent. Well, thank you guys so much for joining today. We have one question here. What should we write for the rest of the questions, or no notes for those? You can go through that process mentally, the open leaf process, or what you can do is you can make abbreviated illness scripts for that. I think the goal here is really capturing the vignette and kind of copy pasting or constructing your own worldview on how to write that vignette. So you can do a more abbreviated version for that. Okay. If you need a better explanation and the UWorld explanation is not clear, write that topic down later on, finish reviewing the whole block, and then go to an external resource. Should we go through all the incorrects? The answer is the incorrects, you should be going through all of them. And some incorrects will be very quick. If it's a silly mistake, others will be a little bit more more in 100 into mixed every day. How can we use the Amboss QBank? Well, like I mentioned, Amboss and RX are kind of like those supplemental question banks. So what I do is I say, okay, I was missing imperforate hymen in UWorld. Then I'll go to Amboss and I'll do the tutor mode questions on imperforate hymen. So I basically create this channel or workflow where I do UWorld, figure out what are my Fab Fives, then go into those focused review questions. Okay. Here's going to be the link for the Notion template if you have not utilized it just yet. All right. Excellent. Well, thank you guys so much. 100 to 120 questions. Yep. All right.